I was getting ready to accept the fact that I'd be fat for the rest of my life. Then I gained 50 something pounds over 7 to 10 years. When you're not hungry and you see how much easy accessible food there is, it's alarming. To gain agency over food is a crazy feeling. It's interesting, right? Like if you're fat and someone perceives you as someone that should be on a GLP-1, they kind of give you a pat on the back. But if you're thin, it's kind of like how dare you be on that drug?
When I have a patient who's under 30 and has lost over 100 pounds, it is surprising to me. I think the GLP-1 drugs are incredible. I mean, they're probably never going to eradicate obesity, but hopefully patients will have access to these and be more comfortable trying them and signing up for surgery. Surgery is not going to fix a personal aspect of your life.
Hello and welcome to Get the Skinny, where experts unpack the ripple effects of GLP-1s one field at a time. I'm Zach Jacobs, the founder of Journey GLP, and a GLP-1 user who lost 40 plus pounds and gained 400 new questions. You know the before and after photos? Well, yeah, the show's about the part after that, because no one tells you that after you lose the weight, you might also lose your butt or your jawline or your sense of self. They don't tell you that once the compliments fade, you're left with loose skin, new insecurities, and a totally different relationship to your reflection. We talk about side effects in medicine, but what about the side effects of success? That's why I started this series, not to talk about weight loss, but to talk about what happens when it works. So, you lose the weight, but no one tells you what happens next. For many GLP-1 users, the scale goes down, but the mirror reflects a new set of questions. Loose skin, new contours, new insecurities. Today we're joined by Dr. Laura Gowan, a board-certified plastic surgeon who specializes in helping patients reclaim comfort and confidence after major body changes. Whether you're navigating the emotional shift after rapid weight loss or just curious about what's real versus what's hype when it comes to plastic surgery, Dr. Gowan brings both the science and the soul. This conversation isn't about vanity, it's about agency. And if you're a GLP-1 user wondering what comes after transformation, this one's for you. So with that, Dr. Gowan, thank you so much for taking the time to join us today.
Sure, no problem. Thanks for having me.
You got it. It's a pleasure and an honor. So if you could just quickly give us a quick rundown on who Dr. Gowan is.
Sure. So I am a board-certified plastic surgeon. I practice in Bryn Mawr, Pennsylvania, and operate at a few surgery centers and major hospitals in the area. I've been in private practice for the past 10 years in Bryn Mawr. I went to medical school and stayed for my residency at Georgetown University in Washington, D.C. After the 4 years of medical school, 6 years of residency, I went on to do a 1-year fellowship in breast microsurgery as well as cosmetic surgery. So I have experience operating on all parts of the body for cosmetic and reconstructive purposes.
Awesome. Thank you. So now we're going to do a quick fact versus fiction. Tight skin always bounces back after rapid weight loss.
Fact for the most part, depending upon your age.
You can't get a tummy tuck unless you've kept the weight off for a year.
Fiction, but I usually say 3 to 6 months of a stable weight.
A lower BMI automatically means lower surgical risk.
Fiction. It's again, other medical comorbidities can play a big part. For equal medical history, I would say yes, lower BMI, lower risk.
There's no difference between a tummy tuck after weight loss versus after pregnancy.
Fiction.
Everyone needs a body lift after losing 50 pounds.
Fiction.
GLP-1 weight loss hasn't really changed the plastic surgery field.
Fiction.
Ozempic face is just a media exaggeration.
Fact, I think.
Fat transfer procedures are increasing because of GLP-1 weight loss.
Most likely a fact, but I still think it's going to take time for that to catch up. But more people have access to weight loss now.
Post-weight loss patients all ask for the same Instagram body.
Fiction.
Most patients know what they want when they walk in.
Fact, but we can't always deliver it.
All right, thank you. So now we'll do the red flag, green flag.
Okay.
Red flag, green flag. A patient brings in a GLP-1 TikTok video to the consult and says, I want to look like this.
Red flag.
They're still losing 1 to 2 pounds a week and they want to schedule surgery now.
Red flag. Need more time.
They show you a celebrity who lost weight naturally and say, this is what I'm going for.
It's a medium. Sometimes it's good to have patients give us an idea of what they're looking for. But if they are expecting that picture as a result, that is a red flag.
Red flag or green flag? Your patient says they're not gonna tell anyone about their surgery, not even family.
Red flag.
These are kinda obvious red
A lot of red flags
Yeah,
here.
that is alright, we're moving into the next section. Red flag or green flag? A patient comes in looking for a tummy tuck, arm lift, thigh lift, and breast lift all at once.
Big red flag. Very dangerous.
Red flag or green flag? A patient's only been off of a GLP-1 for 2 weeks and says they want you to operate on them.
Still red flag, too long. I mean, some of these things I think people might not understand. They're coming to you for advice and they might want to be operated on, and that's perfectly fine, just not quite yet.
Red flag or green flag? A patient asks that if after surgery, will this, quote, make them feel normal again?
I think it's a green flag. It depends what they're looking for. I think if people have a reason or they're having surgery to make them feel better, feel more normal, that is fine. But I think when people are looking to have a surgical procedure and that fix a specific aspect of their life, like I don't feel comfortable dating, I need to have surgery so I can date, or I don't feel comfortable with my partner, I need to have surgery. It's not going to fix some of those things are emotional and they have other things that go into them. Surgery's not going to fix a personal aspect of your life. It might make living it more comfortable in certain situations, but thinking that your life is going to improve in a specific social aspect afterwards is not always a good thing.
It's that's one of my idea or one of the own things. My own talking points is after losing 48 pounds, it's not like I'm just Brad Pitt all of a sudden, which you would think
Yeah.
would be the
Yeah.
case, but it's just not the case. You have your life.
You're close.
Thank you. But all right. So question number one: when did you start to observe like this wave of GLP-1 patients? So what I think is interesting here is the drugs have been around for a while, mainly with diabetic patients. And then all of a sudden,
Mhm.
it seems like around 2 years ago, it's just all over the news. And, so I'm just
Yes.
kinda curious, did you kinda see the same, onslaught, immediate, like, all of a sudden, knock, knock, everyone's on a GLP-1, or was it kind of a
Yeah.
slow and steady
I would
um
say that, sort of them being in the forefront of my mind and in a conversation with every patient I'm operating on, be it for cosmetic or reconstructive purposes, I'd say that sort of has happened maybe in the past year, year and a half. But I can remember a few patients maybe 5 or 6 years ago that came to me after losing 100+ pounds that were in a study at Penn. And I don't know exactly what medication they were on. They might not even know. It might have been a randomly controlled trial. And I had never heard of this before. So maybe 5 or 6 years I saw, one every so often. And to be honest, some of my diabetic patients that might be on GLP-1 drugs for that, I don't know that I was as in tune with, their effect on weight loss or their potential effect on, anesthesia or other, benefits, risks.
Mhm.
But yes, I'd say in the past year and a half, I'm, looking for those medications on the list my patients provide me, asking them before surgery at pre-op visits, and making sure that they are aware that they will have to stop these medications preoperatively and their effects on um, their body when they undergo anesthesia.
Mhm. And is everyone pretty upfront about their usage of GLP-1s from a patient perspective?
Yeah, I don't I people I mean, again, I don't know what people don't tell me, but it doesn't seem like patients are, feel uncomfortable telling me. I saw a 21-year-old female today for breast reduction, and she is on a GLP-1 medication, and she was by no means obese, maybe slightly overweight, but there are patients that I don't expect that would be on these medications and are.
Mhm.
So it's one of those things you just have to ask everyone because you never know.
So today was kind of a surprise, but in general, is there like a new patient profile of a GLP-1 user for plastic surgery?
Um, I mean, I see breast cancer patients of all ages, weights, and body shapes. And, again, I'm asking them all, and diabetic patients, I wouldn't say there's a specific type of patient that comes in. My massive weight loss patients or any weight loss patients, they oftentimes have, maybe at their maximum weight, weren't a candidate for surgery, started out with medical weight loss, then were a candidate for surgery, and then post-op after bariatric surgery are back on a GLP-1 medication to lose a little bit more weight or kind of keep them stable. I don't know that there's a specific patient coming in. Aside from the fact is that, yes, I guess sometimes I'm surprised
Mhm.
as to who is on the medication or who is not on the medication.
Mhm. Yeah, I think, just in my life as a civilian, that's kind of the interesting dichotomy of where people say you're cheating, where it's like if you're perceived to it's interesting, right? Like, if you're fat and someone perceives you as someone that should be on a GLP-1, they kinda give you a pat on the back and say, "Good for you." But if you're thin or not heavy,
Yeah,
it's kind of like a,
yeah,
"How dare you be on that drug?" Which
yeah, or do you really need that?
right, and that's where, like, the cultural switch happens for people, where if they're, like, a hater or a lover, it's, like, kinda that's the line,
Yeah.
for whatever reason. Have you seen demand for specific surgeries or treatments increase with the increase of GLP-1 users kind of invading, the plastic
I
field?
Most of my referrals, I mean, obviously, I have patients that come in just from word of mouth or finding me online, but most of my direct referrals come from bariatric surgeons. So I tend to see a lot of people that have had surgical weight loss procedures. I'd say that in my practice, I don't know that I've specifically seen an uptick. I think I have a pretty stable rate of referrals or new patients coming in. But if you look in the plastic surgery literature, I don't know that this is GLP-1 specific, but over the past 20 years, the rates of body contouring procedures has significantly increased. Like abdominoplasties, I think from 2000 to 2020 went up over 50%. But if you look at the larger body contouring procedures like lower body lift, brachioplasty, thigh lift, they have gone up in the 3,000, 4,000%. So again, not really GLP-1 specific quite yet, but and also the other thing is if these drugs are available, people are going to start using them at younger ages and at lower BMIs. So people may not need the extreme body contouring that they need now after the rapid
Mhm.
weight loss that surgical procedures.
So it makes me think, like, have you seen any younger patients coming in? Or I guess the question is, are GLP-1 users split amongst all ages, or are they kind of skewing younger and therefore necessitating, like, a younger tummy tuck?
I Again, for several years, I've seen younger patients and older patients. I'm not always surprised by the middle age or older patients, but when I have a patient who's under 30 and has lost over 100 pounds, it is surprising to me. But possibly these patients, when they're younger, if they're getting these medications in their 20s, they may not, again, they may be able to lose weight prior to gaining so much that it necessitates surgery. And those younger patients, their body is going to respond better to the weight loss. Their skin has better elasticity and likely have less excess skin and visible fat loss.
Mhm. Like, so what is the GLP-1 menu, so to speak? Like, what are the types of procedures people are either asking about or should be asking about?
So, I mean, I think for the face, and again, depends on your age, depends on how much weight you've lost. People who have lost weight rapidly, the first thing you see in patients that you know or recognize is changes in their face.
Mhm,
And the fat in the face is fairly superficial. So if you lose a lot of weight rapidly, you'll see it there, sort of hollowing in the mid face. For younger patients, and maybe some jowls or excess skin in the neck, I see
mhm,
in middle, later 40s, 50s, 60-year-old patients. So for those patients, if it's more of a volume issue, it could be fillers or fat grafting. For older patients or patients that lost a significant amount of weight that have the extra skin, they might need something like a neck lift or facelift. For the breasts, it can be either or. There's some people that that still have a lot of breast volume and they need a reduction with a lift. There's people that have significant skin excess, yes, but no volume, and they need a lift with a breast implant. As for the arms, thighs, tummy, for a younger patient with good skin elasticity, sometimes they can get away with liposuction or some liposuction and energy devices. If they have a significant amount of skin or poor skin quality, then they would need a surgical skin excision procedure like a brachioplasty, tummy tuck, thigh lift, lower body lift.
Everything.
So again, it really just depends how much weight they lose, how quickly they lose it, and how old they are, their skin quality. It's it's different for
For
everybody.
everybody. No one size fits all.
Definitely
It's a
not.
really interesting thing with these GLP-1 drugs. I was gonna try to make another joke about one size fits all, but, like, what's interesting is everyone reacts to it totally differently. So I was on Ozempic since October 23, took it for, like, 9 months, went off of it for 6 months. I've been on a maintenance
Mhm,
dose every 10 to 14 days since February.
mhm,
I'm still on just, like, that starter dose, 0.25, and then my cardiologist switched me over to Wegovy, and I was, like, a little nervous. I wasn't sure what was gonna happen, if I would have other effects, but I really didn't think I'd feel anything because
mhm,
I've already had it in my system for so long. I injected
mhm.
Wegovy at 3 p.m. on Sunday. By 10:30, I realized I wasn't like, I usually like to eat some before I go to sleep, like,
Yeah,
within 6
who doesn't?
6 hours, I was done eating. So it was
Wow.
kind of interesting where there's no I'm a super responder to it. I don't know why or what it is, but I've never gone up past 0.25.
Okay.
Little tangent there, but, bringing this back, so the mommy makeover, this is new to me. I was
Okay.
prepping, I see it on your website. Have you worked on the
Uh-huh.
thing or have thought about what the GLP-1 glow up entails?
I would say, again, for a younger patient with maybe moderate weight loss, maybe some fillers in the face. For breasts, maybe a breast lift, small reduction. For the abdomen, thighs, arms, maybe it would just involve body contouring, even external devices like cool sculpting, maybe if you need a little bit more liposuction. For more massive weight loss, maybe 75, 100 pounds, or an older patient, they probably then will also get into the skin excision procedures. They will probably need some volume replacement in the face with fillers or fat grafting, might need a neck lift, probably, brachioplasty for the arms, breast lift, plus or minus reduction, tummy tuck, thigh lift. Again, it's different.
Gotcha.
But what I would talk to people about is it's not all at once. It is not generally safe to do body contouring procedures totaling more than 6 hours in a day. That's a lot of surgery for a patient.
Mhm,
Most times I'll focus on one or two body areas at a time.
mhm.
For doing the breast and the abdomen, or if you need to have a circumferential body lift, it will be a procedure in and of itself. There are surgeons that will perform longer procedures, but you just have to be really careful about where you're having the procedure done, who's doing it for you, the risks, complications, and making sure that your body's in shape to undergo a procedure like that.
Gotcha. And, switching gears a little bit, but so one thing that I'm kind of intrigued by, and you experience it almost on a daily basis, if not every day, is, couples. So one of the unforeseen side effects of these drugs and the weight loss is, like, not everyone's happy about it, right? So, like, some members of the couple like things the way they were. If it wasn't a
Mhm.
GLP-1 patient, and let's just, like, for the purpose of the question and the example, we're talking about, like, a breast lift or, like, a right, boob
Right.
job. So consider my male gaze and my bias, but, like, normally I think the male partner would be, like, all fired up, right? Like, all right, we're gonna get a boob job today. Are you seeing it like with the GLP-1 partnership? And I don't know if this is coming across clear, but, like, is the excitement different? Are there different emotions at play in the consult room than, like, my wife wants this or I want my wife to have this or vice versa?
I think that and it's very different for each couple. Not everybody comes to consults with a family member. I think it is good oftentimes. I like to see patients with their family at least for one visit before surgery. I see patients for initial consultation, and then I will see them again for a pre-op visit to kind of finalize the plan, go over expectations, what they need to have at home, what they need to be ready for. It's nice, I think, to have a family member there to understand what they're going to be going through, what to be prepared for. I think that in general, people who are in, a stable everybody's relationships are different, but I think the most important thing is people being supportive of their partner, no matter what is going, whether they're happy they lost weight or unhappy they lost weight, or, understand why they're undergoing the procedure or don't want them to. I think that it's very important for people to have these conversations with their spouse, kind of be on the same page before coming to the
Mhm.
visit, because it's difficult. Again, my job is to talk to the patient, make them feel comfortable, see what they're interested in, and try to work out a plan for them. I like to operate on people to make them happy, not to make their spouse
Mhm.
happy. But I'm sure there are patients out there that they have, their spouse has different feelings about things. But most times, luckily, I encounter patients and they're happy for their significant other.
Mhm.
I think the only thing would be is, if somebody wanted to have surgery and their spouse didn't feel comfortable with them doing it from a safety standpoint. And sometimes that concern is valid and I'll talk about it. And sometimes I just explain, why I think it is safe. But I don't know if I have an answer for how patients are getting along, but,
Yeah, I just think there's
um
the aesthetic reason to do it, there's the medical reason with
mhm,
cancer involved,
mhm,
and now
mhm,
there's this third one where it's
mhm.
like, "I never thought I'd lose 50 pounds in a year, and I wanna do
Yeah.
Y or Z," and, it's just like
Yes.
you're starting to
Yeah.
be reported and you're hearing people talk about it, like, just in my conversations, like, just little snippets of so and so doesn't like this, or I don't like this about them, or whatever it is, which is kind of
Yeah.
totally unexpected.
Yeah, and it's different, I think that some people, they're in a relationship and things are kind of stable, and a big change in your body or your partner's body can be different at home and outside of home, and having midlife crisis type issues. There's a lot of social and psychological things that you have to deal with when you're undergoing a big change in your body
Mhm,
like this, and that can be difficult on both people or all people in
mhm.
relationship.
And for people interested in learning more, reading about different procedures, what's the
Mhm.
best resource besides ChatGPT?
Yeah, I mean, honestly, yes. I mean, the internet is wonderful and it also dangerous. The American Society of Plastic Surgeons has wonderful resources on their website. They have explanations of many different procedures. There are options where you can, communicate with a board certified plastic surgeon and ask questions. They also have before and after pictures that surgeons from all over the country can submit. I believe it's just members of the American Society of Plastic Surgery. So you can see patients of all ages, shapes, good results, bad results, probably no one's sending their terrible results, but it's a good way. You have to be very careful when you're looking at things online, because not everyone is honest with their before and after pictures. And it's a really difficult thing to tell sometimes. And again, not, most people will try to have a range of outcomes on there. I like to have many people of many different sizes and shapes in my before and after books, so people can kind of find somebody that looks as close as possible to them. Because, if you're finding a picture online of somebody that is not your height, weight, BMI, age, it's going to be very difficult to compare your possible result with theirs.
And have you ever turned down a GLP-1 patient asking for a surgery or said come back after you've thought about it a little more? If I don't know if that's
Um, no, I mean, not particularly. In general, I mean, there are patients that come to me with cosmetic concerns. If I think that I can provide them with the result they are looking for, I will offer them surgery. Oftentimes, there's patients that come that what they are concerned about, surgery is not worth the risk. I don't think they're going to be happy. They might have just a small amount of extra skin or a small amount of extra fat that surgery might actually make them less happy than they are. So, and there's other people that have if people have unreasonable expectations, that I don't think they have a good understanding of what is a possible result for them,
Mhm.
or people that their weight isn't stable. I like people to be medically optimized. They have to be in the best place, with regard to their any current medical problems. If they're a diabetic, their blood sugar under good control, high blood pressure, that under good control, stable from a cardiac and respiratory standpoint. But also if they are, still undergoing their weight loss journey, their weight needs to be stable for at least 3 months prior to having surgery. And I want them either at or very close to their baseline weight. People are going to have their best results and do the best after surgery under anesthesia if they are close to that goal weight.
Mhm.
There are studies that show that, even patients that get themselves down to a BMI under 30, if they have lost a significant amount of weight, they still are at higher risk for complications as opposed to somebody who has not
Gotcha.
lost any weight. So getting people optimized is really important to give them the best chance at their desired result.
If you had one big piece of advice for a GLP-1 patient seeking out plastic surgery, would it be at a 3-month steady baseline, something else?
I would say, it's never too early to see some. I guess maybe if you just started medication a week or two ago, but if you've been losing weight for a couple months, have a goal in mind, you've been able to maintain a healthy lifestyle, I think that going to see a plastic surgeon to see when the best time for you to have surgery would be it helps you plan because, sometimes I will see people or they've been waiting for an appointment or yeah, maybe they've waited too long to come in and I tell them, "Oh, well, you need to wait X, Y, or Z amount of time." I think coming to see somebody, have a plan, know what the surgeon's expectations of you are in terms of weight loss and maintaining that, so that way you can find an ideal time for surgery. Maybe meet them once or twice after your initial consult to make sure you're both on the same page and that you're in the best place to have surgery. But in general, I tell patients we want your weight to be stable for 3 to 6 months.
Well, thank you very much.
Yeah,
I think that's what I got, unless there's anything you wanted to cover, but I think we
okay.
kinda danced around it, and, that was great, so I don't
Yeah, no problem. Hopefully that's helpful. I don't wanna say weight loss is weight loss, it is different for different patients, but I guess when I'm seeing the patients, they've had so
Yes.
many things. It's like they've had a little of this and a little of that, and I think the GLP-1 drugs are incredible, and I think they are going to they might they're probably never gonna eradicate obesity, but hopefully patients will have access to these and be more comfortable trying them than signing up for surgery, and, they might not get to that point where they're morbidly obese,
Right. I think, like,
so
just before we
but yeah.
started, the Associated Press sent a push notification, children in the US are as unhealthy as ever, and for me,
Yeah.
the thing that was wild for me that kinda waltzed in like, my cardiologist put me on it, right? I didn't seek it out f to
Yeah.
lose weight. To gain agency over food is a crazy feeling. Like, for some
Mhm. Yeah.
this thing food noise, which some marketing guy just came up with because 'cause I've never heard that before.
I know,
Never.
I have heard my patients say that to me
Yeah,
sometimes.
and, like, you Google, it's like, "Oh, yeah, this is an accepted term." I was like, "I'm 33 years old. I've never heard that term." But just
Yeah.
today, like, at 3:20, an hour before this, I felt hungry. I had a 100-calorie Chomps beef jerky stick, basically, and halfway, like, 50 calories in, I was like, "I'm not hu like, I'm done. I'm fulfilled." We're
Oh,
nor
that's impressive.
but
I can't do
it's
that.
crazy. Like, it used to be, though, like, if there was a plate of food, like, the whole thing's getting
Yeah.
finished. If I ordered delivery, the
Yeah.
whole meal's getting finished, and now, like, you get so much time back, you're not thinking about what to eat, and it allows you to go work out or something or do whatever the hell it is you wanna do because you're not thinking about that meal. So, I think it's really
Yeah.
interesting, and then I appreciate you taking the time to do this because the trickle down of all these people then kinda rushing to s or thinking about surg like, I was getting ready to accept the
Mhm.
fact that I'd be fat for the rest of my life. It took me I have this weird body dysmorphia happening right now where I was this weight my entire life, then I gained, like, 50 something pounds rapid over, 7 to 10 years, and, like, every year was, "I'm gonna get my back together again. I'm gonna get it together
Was
again,"
run.
and then it finally was like, "I'm giving up," right? Like, I'm fucking giving up. Like, it's been
Yeah.
10 years. Like, I'm about to equate my fat life to my skinny life in terms of time.
Yeah, interesting.
And then this
Yeah.
doctor was like, "Let me help you. Like, you need it. Let me
Yeah.
help." And the interesting thing for me now in terms of, like, dysmorphia is when I look in the mirror, I have no idea what looks good because I finally was accepting, like, the skinny me was gone, and now I'm hefty.
Yeah.
And now I'm in they call me a medium. I'm small/medium. Um but it's, like, super and I'm, like, a 33-year-old dude that's, like, never really thought about any of this, and it totally flipped my switch and, like, flipped everything on its head, and, like, going back to
Yeah.
the food point, when you're not hungry and you see how much easy accessible food there is, it's alarming, and so, I think what we're gonna get into is that big food's been keeping this quiet for a while. They're incentivized to.
Possibly.
Yeah,
Yeah.
right? So I think it's super interesting.
It's definitely a battle. I think the difficult thing is gonna be how are the drug companies gonna keep up with the demand, and how are insurance companies going to are they going to continue paying for it? Because I was gonna say, they obviously, I think in some respect, it is gonna help them keep costs down because it's going to decrease the amount of downstream medical, like sleep apnea, high blood pressure, coronary disease,
First
cancer.
drug in history
Uh,
to be approved for sleep apnea.
but what are the criteria going to be, and how long will they pay for it for? And yeah, it's a
Yeah,
very
so I've never thought
interesting.
about this, but it's a little wacky that my insurance covers my finasteride, but not weight loss medication, right? That's crazy. I could be bald and happy and healthy, but I couldn't be obese and happy and healthy, right? Maybe obese and happy, but,
Yeah, crazy.
anywho, thank you again. Have a great night.
You're welcome.